Health and Medicines Committee met on the 14th of October for the first meeting of the new council session. We welcome Victoria South to the group, which is fantastic to have her expertise on council and on health and medicine specifically. A lot of our discussion was picking up on ongoing projects. The biggest body of work we're engaged in is around antimicrobial stewardship, and obviously that is a big task and is ongoing. So Bruce Blade and James Crabtree have been doing a lot of work trying to quantify antimicrobial use in equine practice, which is obviously challenging. A lot of the equine antimicrobials that we use are not registered for equines, so whilst records are kept at VMD level of equine antimicrobial usage, we have no way of quantifying all the porcine and other products that are used and all the specials that are used. So James and Bruce have been working very effectively with some of the IT companies looking to try and quantify that through practice management software. And obviously this is something we need to do as a profession to be able to demonstrate that we are using these drugs in a responsible way to avoid further legislative restriction. And obviously we want to be able to demonstrate that we are being responsible in our use. So they've made good progress, and in time they'll be engaging with more IT providers and expanding that project, so that's good. We've also got a number of collaborations with other organisations. Antimicrobial stewardship was obviously One Health issue, so there are various different groups that BEVA's represented at, and we had some feedback on what those groups are doing. Tim Mayer has just completed an antimicrobial survey, which many of you may have participated in, so thank you if you had. That was encouraging. It gave us some good data on how widely guidelines are being implemented, and also gives us some data that we can use moving forward, so I'm sure we'll filter some of that data out. Antimicrobial Stewardship or Antimicrobial Awareness Week comes up in the middle of November, so we've started planning some activity around that. There's going to be a webinar, there's going to be some social media campaigns. We're going to try and provide a lot of resources that you guys can use, hopefully within practices, and also to try and communicate the message out to horse owners to try and make them understand why we may be why we are reducing our antimicrobial use and why we might be declining their requests for antimicrobials because they're not clinically indicated. So please get behind those campaigns. Please use the resources that get sent out, and if you've got any feedback, then please let us have it. So that was antimicrobials. There's a lot of ongoing work around it. Like I say, we're also working on Antimythics. The committee are pretty concerned about the current situation with regard to Antimythics, with the level of resistance that is clearly present within the equine population and the absence of any effective alternatives to the Antimythics we currently have. I think we're all conscious that Antimythic use in the UK is not anything like we would like it to be. It's far too indiscriminate. So we've had a stakeholder group that's been working for 12 months or so looking at strategies whereby we might be able to improve antimicrobial stewardship, and that work is ongoing. We had some discussion around the devastating loss of the Animal Health Trust, which we're all obviously extremely sad about and leaves a very big hole to fill. There's a lot of discussion ongoing that BEVA is actively engaged in. Obviously, it's not necessarily stuff that can be discussed in the public domain, but BEVA is working hard to try and ensure that the services that the AHT provided for preserving equine health are maintained into the future. We're doing a piece of work looking at the website, the health and medicines pages. We've already been working on, or Mark Bowen primarily has been working on revising the Protect Me guidelines, which will be re-released shortly in their new form. So we would welcome any feedback on that. Hopefully that's helpful. We know that most practices are using them. It would be great if those that aren't are inspired to do so with the new guidelines. Any feedback, please let us know. Similarly, any feedback on the website itself, we'd be pleased to hear it. We're constantly going through a process of reviewing the content and updating the content on the website. As you can imagine, it's a big job, and the BEVA office have been doing a huge amount of work along with members of council. But if you have got any comments or you spot any gaps that you'd like to see filled or any howlers that you think we should have updated, then please either let the office know or by all means let me know. That was the body of the meeting was around antimicrobials and antimythics. We did have some discussion of legislative change around Brexit, around horse exports and imports, and around EVA testing. So there are clearly some concerns around those topics, and again they will be fed back to government, and hopefully we can try and tweak policy to make it more aligned with the way we would like it. So that's going to be a slow process. Obviously, there's a huge amount that's unknown around the Brexit situation, so it's very difficult to be confident of what's going to happen over the next 12 months or so. But we are doing what we can to try and ensure good outcomes. That was pretty much it for the meeting. So please watch this space around resources that will be coming out over the next couple of months, particularly around antimicrobials, and please feel free to give us any feedback on those resources and give us any suggestions of how we might be able to continue to help you guys with implementing antimicrobial and antimythic stewardship programs. So thank you for listening.